Hi, everyone. We're just giving it another minute so, all of our guests can join us. Looks like we have some more people logging on right now, so just a couple seconds here. Okay. Thank you for joining us today. My name is Laura Masenka. I am with the events department here at Philabundance. And before we get started, I just wanted to go over a couple housekeeping things here. We are recording this, so if you drop off early or are interested in sharing some of this content with your peers or friends, feel free to share the recording that we send out later this week. Along the way, we encourage you to submit questions via the chat box. We do have a Q&A portion later in the presentation, and we can address some of those questions. If there's not enough time to get to all the questions, we'll certainly follow up with you and connect with you via email. And of course, all lines are muted. Now I will turn everything over to our Chief Development Officer, Sara Hertz.
Good afternoon, everybody, and thank you for joining us. If you haven't joined us before, welcome, and welcome back to those who have attended prior town halls. I did want to pick up on Laura's list of reminders and tell everybody that please feel free to use the chat box for questions, and we have allowed time for questions at the end of our presentations. So why are we talking about senior hunger today? I think people know that many senior citizens struggle with food insecurity. About 1 in 14 seniors nationally were food insecure in 2018, and you're going to get a lot more data points moving forward in this presentation. But about 65% of seniors facing food insecurity have an income above the federal poverty line, which means that even those with relatively secure incomes still struggle to get food. And here at Philabundance, pre-COVID, about 14,000 of the 90,000 people we serve each week were seniors. So there certainly is a demand. Again, with COVID, seniors are at the greatest risk, really, for many of the complications and death that are related to this. And food access has become a significant issue during the COVID pandemic because of social distancing, isolation, the changes in the food supply, and basically fear of older people of contracting the virus. So I'm really happy to introduce today's speakers. In order of presentation, I'm going to introduce you to Amy Goldstein, who is the nutrition manager at Philadelphia Corporation for the Aging. As a registered dietitian, she focuses on PCA's nutrition programs for older adults, such as a congregate and home delivered meal programs and the Senior Farmers Market Nutrition Program. She's also an organizer for the Defeat Malnutrition Today Philadelphia Coalition, and she co-chairs the Resources Committee for this group. She received her Master's of Public Health from NYU with a focus in community nutrition. Then you're going to hear from Philabundance's very own Vickie Rossi, who is the Government Distributions Coordinator for us. She has been here for about 3 years on staff. While she was beginning her career with Philabundance, she was also completing her Master's of Science in Sustainable Food Systems at Green Mountain College in Vermont and Prescott College, Arizona, with a concentration in food security and food policy. But prior to coming to Philabundance, Vickie had a very different career as Vice President and Senior Relationship Manager at Wells Fargo, working for almost 20 years in the financial services industry, managing large corporate retirement plan clients. Vickie is also a great long-term Philabundance volunteer. Jodi Roth-Saks is the Executive Director of the Jewish Relief Agency, and she joined that organization about 2 years ago. Before then, she oversaw the Department of Service Learning and Volunteer Programs at Westchester University. She was also one of the founders of that university's resource pantry, which provides food assistance and financial literacy workshops to hundreds of students. She currently also serves as a board member for the United Way of Chester County. And Portia Kamara, MSW, is the co-founder and executive director of Multicultural Family Services. She is an immigrant from Liberia, West Africa, and is the co-founder and executive director of the organization, a social services nonprofit in Upper Darby. Portia is known as a cultural broker and an African and Caribbean immigrant advocate. She has an MSW from Temple, a graduate diploma with a specialization in child welfare from the University of Pittsburgh. She's also a certified Lakeside Institute trauma instructor, has a certificate in trauma from Bryn Mawr College, and is a certified National Council for Behavioral Health Youth Mental Health First Aid instructor. A very accomplished group of panelists, as always. We're delighted to have them. And we also have with us today the Chief Executive Officer of Philabundance, Loree Jones. And now I'm going to hand the presentation over to Amy to get us started. Thank you.
Hi, everybody. My name is Amy Goldstein. As was introduced, I'm the nutrition manager at Philadelphia Corporation for Aging. And so just to give a little bit of information about PCA, PCA is the Area Agency on Aging for the County of Philadelphia. So if you're from another county, you may be served by a different AAA. And our mission is to improve the quality of life for older and disabled Philadelphians and to assist them in achieving the greatest possible levels of health, independence, and productivity. And so my focus, as we talked about earlier, is nutrition in our nutrition programs. As Sara mentioned, we know that hunger is an issue for people who are older adults, and we serve those who are 60 and older through our AAA, as well as those who are disabled. And so we know that about 1/3 of seniors 65 and older may be suffering from isolation, which is a contributing factor as well. The statistics are really hard to describe during the pandemic, compare them to pre, but we do have that data for the pre-pandemic time period when up to 1 in 2 older adults were either at risk for becoming malnourished or are malnourished. And so for Philadelphia, with about 270,000+ seniors, 60+, we know that about 1 in 4 of those seniors are in poverty, so at risk for being malnourished and facing food insecurity. As one of the poorest cities in the US, we know this impacts their ability to access fruits and vegetables, but also other pantry items. And so what we hope to do through our programs is to ensure that people have access to food to sustain them and also get that social connection that they would maybe not get due to living alone or maybe not having their family around anymore. So the first program that we use to achieve this is the Congregate Meal Program, and this is the program that has seen the most change due to the pandemic. In normal times, we have 22 senior centers and 9 satellite programs in Philadelphia where they serve lunch Monday through Friday to seniors 60 and older who do not have to pay for their meal. And during that programming, they may see other types of events such as special occasions, but also fitness classes, arts programs, and also just the socialization of being with other people. Obviously, these are not happening as they typically would right now. So right now, these are all moved remote, and everybody is able to still access food and get a meal for each day of the week. But instead of doing it together, it is done through a grab and go system. So seniors are able to pick up meals for the week by going to the senior center, or sometimes are getting delivery or have a friend or family member pick it up for them. This is funded through the Older Americans Act, and right now there are waivers for this program that allow for leniency for meal requirements and for those meals to be taken to go. Typically that's not allowed because the point is for that socialization to happen between the seniors at the senior center. We're hoping that we do get a new bill passed to extend those waivers and increase the emergency funding that we've received in the previous federally funded programs. And so, like I mentioned, since COVID started in March, during that time we closed to participants, all locations, so that they were not able to come to the center. But during that time, we did offer we do and continue to offer a grab and go delivery model. We partner with volunteer organizations to deliver meals to existing participants and new participants. So these would be people that may not have previously needed help, or maybe were getting food support from other locations, but now are coming to PCA for that support. And senior centers are now operating virtual programs. So doing nutrition education virtually, doing a phone call, a Zoom call, webinars, and also senior center staff continue to do wellness calls with the seniors to make sure that we are checking in with them. Our senior centers are an opportunity where we distribute CSFP boxes that Philabundance provides, and that has needed to shift. Those are usually some of our busiest days at the senior centers, is those distribution days. And I'm sure Vickie will be talking about those boxes. That has needed to shift our distribution of them, but it still is a great opportunity to extend the food that we're providing. The next program I'll be talking about is the home delivered meal program. And this is our model where we deliver meals to those who are in our in-home support program or our long-term care program. And we're distributing about 850,000 meals each year. And so that was based on a typical year. This year we are seeing an increase in those as well. And the difference between the people enrolled in this program versus the congregate meal program is that they will have long-term care needs, and that's determined through an assessment process that they are also homebound. And so again, another place where we've received waivers is that definition of homebound. And so we're hoping to get that waiver to continue to ensure that we can do delivery to those who may not have traditionally met the definition of homebound through the assessment, but now due to COVID and those restrictions and those concerns to their health, that they can continue to receive meals delivered to their home. PCA sources our meals from vendors, and then our PCA staff and fleet distributes those meals to seniors throughout Philadelphia. And one of the great things that has been shown through our model is that because we have our staff and they're consistently and well trained, and we can train them on PPE and other protective measures to keep the seniors and themselves safe, we were able to operate since March with no disruption in service. And that has been a really great pride of ours, that all the seniors that have been enrolled in the program have continued to receive their meals. Our meal distribution center is up in North Philadelphia, and their fleet of trucks there's a picture of one on the slide. So if you see those around Philadelphia, you know that's us, and one of our PCA drivers is delivering meals in your community. We continue to pack and deliver meals to seniors, taking additional precautions with a drop and go model, and waiving the need for signatures, which has been approved by our funding sources, that we are going to waive the signature so there's limited contact between the driver and the senior. Like I mentioned before, with the recent kind of news about funding and federally funded, we are hoping to continue to extend those waivers and get increased emergency funding for these programs, as it can sound like this does take additional steps to ensure that this is done safely and that we are not exposing either our staff or the seniors to any potential infection. And the final program I'm going to talk about today is the Senior Farmers Market Nutrition Program. And the Senior Farmers Market Nutrition Program is sometimes called SFMNP, senior vouchers, etc. This program is usually very hands-on, and this summer we did this all remote. Usually seniors would go to a senior center, a community distribution, or come to PCA to receive their vouchers, but this summer we did this all by mail. And so all vouchers, applications were sent out by mail and received by mail, and then vouchers were sent again out through the mail, all during the summer when we know there was mail delays. So this was a bit of a barrier, but we were able to just finish our distribution at the end of September, and all applications that PCA has received have now been processed and vouchers have been sent. So our final day has passed, but the good news is that seniors can still redeem their vouchers at area farmers markets. They must be used at Pennsylvania farmers markets. And a limitation we're finding this summer is the number of markets that are taking the vouchers, and that has been a barrier that we're seeing continue as the redemption period continues through the end of November. The number will continue to go down, and so we're hoping that with our push to those seniors to redeem them, that they will be able to access those fresh fruits and vegetables through the fall as well. All right, thank you for listening to a little bit about PCA's programs, and if you ever want any additional information, you can contact me or visit the pcacares.org website.
Thank you, Amy. And in fact, we're going to have a slide with everyone's contact information at the end of all the presentations. That was great. And for now, I'm going to hand the screen over to Vickie Rossi from Philabundance to talk about our own work to relieve senior hunger. Thanks, Vickie.
Thank you. Hello, everyone. Just want to talk the primary way that Philabundance works to relieve senior hunger is through the efforts of our 300 plus agency partners. We work to increase their distribution capacity by supplying food and other resources so that they can serve more seniors in their local communities. And as Amy mentioned, a direct way that Philabundance serves seniors is through the Commodity Supplemental Food Program, known as CSFP. CSFP is a USDA food program whose mission is to prevent hunger and malnutrition for low-income seniors. Just a little bit about the program. Nationally, 705,000 boxes are built each month. PA is the third largest recipient of those boxes. We get approximately 36,000 in the state. And of those 36,000, Philabundance builds and distributes about 4,500 of them. The remaining boxes are distributed through 16 other food banks across the Commonwealth. Typically, the agencies that participate in CSFP are senior centers, senior residential buildings, food pantries, and community centers. We have 49 participating agencies who get boxes from us every month. CSFP provides a free monthly food box to eligible low-income seniors. It contains important pantry items to help them maintain optimal nutrition. The box contains about 30 pounds of non-perishable items, such as canned fruit, vegetables, milk, juice, canned meat or fish, cereal, other grains, and then a perishable 2-pound brick of cheese, which is very popular. Historically, the seniors or their designated proxy would pick up the box directly from the participating agency where they signed up. But some agencies, particularly those that are food pantries, often distribute complimentary fresh items with the box, like fruit and vegetables or fresh dairy. From a budget perspective, the 30-pound box of pantry staples provides about $40 to $50 retail of supplemental food items each month to seniors. From the health perspective, the USDA Food and Nutrition Service designed this box to align with the U.S. dietary guidelines and to provide good sources of nutrients that are typically lacking in the diets of low-income senior population. The items in the box recently were revamped by the USDA to make sure that they were low sodium, low sugar, and offered whole grains as well. From an overall service perspective, there are 6,200 seniors in Philadelphia and Delaware counties that signed up through our agencies to get one of our 4,500 boxes that we build each month. Obviously, there is more seniors signed up than boxes available through us. However, because some seniors don't necessarily take a box every month or relocate, whatnot, for the most part, seniors are being served who would like a box each month. During COVID, we reached out to our agencies almost every week to find out how things were going. They reported seeing upticks in client visits anywhere from 25 to 100%, really during the worst months of the pandemic. We still continue to see increases and decreases as things go on, and other resources are no longer available or less available, or as organizations kind of go back to more regular hours. However, seniors by and large did follow CDC guidelines and stayed home during the worst of the pandemic. We saw that CSFP distributions dropped during these windows, around 250 boxes or so less a month, because some agencies closed temporarily or permanently, or they lost a lot of their volunteers. Many of the volunteers who work at these organizations are in fact seniors. As a result, we worked on a plan with our partners to revise the CSFP service model so that we could get more boxes directly to seniors. We started a mix of home delivery, or organizing that home delivery, and combination with seniors proxies to pick up. This was an agency by agency decision on how it was going to be handled based on their clients and their resources. The Philabundance staff and our agency partners such as Liberty Church and Easter Outreach pitched in to home deliver boxes. We also had assistance from corporate and community organizations, Uber Eats, Logistic Care, Team Rubicon, CMAC. They all jumped in to help with home delivery. CMAC is Southeast Asian Mutual Assistance Association Coalition. It's a mouthful, so we say CMAC. So they all helped to get those boxes to seniors' front doors. We plan to continue this new home delivery model for our seniors who are still not being served by launching a pilot program this month using our own Philabundance drivers and vehicles. We will start delivering about 120 boxes, home deliver those boxes in October. And we will also continue to utilize the organizations that are willing to assist us, such as Uber Eats, Logistic Care, et cetera, as long as they are willing to help. And then we'll continue this pilot through the remainder of 2020 and reevaluate in 2021 where we can go from there. Sarah, I'm going to turn it back to Sarah.
Thank you. Yeah, thank you so much, Vickie. And now I'm going to hand it over to Jodi Roth-Saks with the Jewish Relief Agency to talk about what her organization has been seeing in the senior community and their efforts to relieve hunger for seniors.
Great, thank you. So the Jewish Relief Agency serves about 6,400 low-income individuals across greater Philadelphia by relieving hunger and building community. We are currently serving 3,500 older adults over the age of 65, and that includes about 980 individuals over 85. We also serve 344 Holocaust survivors. JRA's program model is that where we take, we pack about at this point, about 3,800 boxes of food each month, and we are delivering that to individuals' homes. So it takes about 220 volunteers to get the food out to homes. We are serving the 5-county greater Philadelphia area as well as the Cherry Hill, South Jersey area as well. We serve anyone out in the community who is needing support, so you don't have to be Jewish to receive our services. Although we do provide kosher food to individuals, and about 65% of the individuals we serve are Jewish. You do not need to be Jewish to receive our services. Our program model is that we are delivering the food to individuals' homes, and we have a 15-pound box of supplies that we're giving them. I'm trying to figure out how to advance the slide so you could see the photos. So if you could just, yeah, there we go. So on the screen, you'll see a box on your right, and the box has non-perishable goods in it, and it also has hand sanitizer and a mask. So nowadays we're providing alongside the food toilet paper, masks, and hand sanitizer, and hand soap. So we've kind of expanded from just providing food. We typically have protein in our boxes as well as carbohydrates and low sodium food, low sugar food, and then there's usually 1 or 2 fruits and vegetables in the box. If you go back a couple slides, you'll see once a month when we're pre-pandemic, when we were creating a volunteer atmosphere to get all our boxes packed, go back one more. We had a huge warehouse pre-pandemic of individuals who are coming to do public service with JRA. So we saw about 1,000 volunteers who once a month came to JRA on a Sunday to build the boxes of supplies that we were getting out to the families. So pre-pandemic, that was about 3,200 boxes a month of food, as well as supplemental bags. So we had bags that were going out to individuals with kids. We serve about 700 kids. And we also had bags going out with toiletries, and through a partnership with the Philadelphia Diaper Bank and Cradles to Crayons, we were also able to provide some additional materials that our seniors and families with children also wanted, such as the incontinence supplies or the diapers or kid packs from Cradles. So if you advance forward, you'll see this is what it looks like now with the pandemic. So we've hired a small labor force. So our warehouse is not filled with about 1,000 volunteers a month, because obviously that would be irresponsible of JRA to have that many volunteers at once in our warehouse. So now we're really taking a look at how to properly respond to this emergency in a safe manner. So we started with a task force back in March, and we worked side by side with a partner who used to work at the New York City Department of Health to help us create safe logistics for JRA. And what we decided to do was to create a workforce for the organization that was focused on packing the boxes. So each month we have a small group of people who will pack the boxes alongside the labor force. And we've hired about 15 people who pack the boxes. So instead of it taking one day to pack all the boxes we need, it now takes a week. And we're socially distanced, we're wearing PPE, and we're doing whatever we can to make sure that we get all of the boxes for our families out to them. If you want to advance forward, that would be great. So all of our boxes, again, are delivered through our volunteers. So this is just a picture of outside our warehouse where our volunteers drive up, they get their delivery route packet, and then they drive around to the back of the building, and it's no contact, and the volunteer puts all the supplies into the car, and then that car drives over to deliver the food. If you want to advance one more. So what's great is that our seniors, our 3,500 seniors, don't need to leave their homes, which is really important during the pandemic. So what we're trying to do is say to our seniors who are right now, a lot of them are very scared, they're feeling isolated, they're dealing with anxiety about the pandemic. We're hearing a lot from our seniors that they're worried about contracting the virus. We're making sure that they don't have any barriers to receiving our services. So when we go to deliver to our seniors who live in the Jewish Federation housing, which is about 800 seniors, we're not knocking and dropping and going, which is what we do at people's homes right now, which that's also contactless. With the seniors, we don't knock on the doors. We just drop the box in front of to the side of the door, and then we go on our way. I'm calling them ahead of time to let them know that our box has been dropped off. So we delivered to our seniors in Jewish Federation housing at about 6 p.m. at night, one Monday evening a month, because the buildings we've found are quieter because people are sitting down to dinner. So there's less traffic, which pretty much protects everyone involved, because then you're running into less people. If you want to advance again. I want to talk about our Root Owners program. So our Root Owners program consists of a group of dedicated volunteers who are committed to delivering to the same set of individuals 10 out of 12 months out of a year. So what's great about that is that we're building these beautiful reciprocal relationships, and oftentimes long-term relationships, between the individuals who are bringing our boxes to our homes and the individuals who we're providing the resource for. And we have found that our volunteers also like this because it commits them to making sure that they're being involved in public service. But our seniors especially love this because it also provides them with some really great personable one-on-one support and a friendly visit with volunteers. And a lot of times we hear that our volunteers, especially families with children, will go and visit our seniors in Jewish Federation housing with their kids and really brighten someone's day. So besides bringing a 15-pound box of food and supplies, they're also brightening someone's day. Unfortunately, with the pandemic, we're unable to do that. So we're asking our volunteers to, of course, call before they arrive, or we send out a robocall. But we also now have some of these individuals participating in a friendly phone calls program. So this is providing that really wonderful interaction between our seniors and our volunteers, because they're being paired up to once a week have a phone call. In our root owners program, we have about 71 active root owners, and they're delivering over 1,000 boxes of food each month. You can advance the slides again. Great. So what we're seeing in terms of challenges is that our seniors are also worried about leaving the home. They're calling us and telling us that they're worried about going to their doctor's appointments and the pharmacy. And also, we all know that there's about a quarter of our seniors who are living in poverty in Philadelphia. So the need is really and there's a really high need here in Philly for our seniors to receive more services. And our seniors are also dealing with heightened nutritional needs as well. So I've already talked about some of our new initiatives, our friendly phone calls program, but we also have caring cards that are going into our boxes for our seniors. And then the last thing I want to mention is the supplemental bag for our Holocaust survivors. So we started in March, and for 4 months, we provided a supplemental bag with face masks and hand sanitizer and, excuse me, and other items to our Holocaust survivors, and there was also food in there. There was disinfectant in there. There was toilet paper, all sorts of things that they might need. And we found that our seniors were so incredibly thankful for the additional resources. And again, we're serving about 340 Holocaust survivors. And I think it was Vickie or Sara who had said, what other resources could we use? And I think all of us could probably use additional support for funding, as we hire a new labor force for JRA, who's helping us to pack the boxes. And we also provide PPE to our clients and our volunteers and our staff, and incur additional costs for cleaning the warehouse. I think all of our agencies are really struggling with the additional costs because of the pandemic. So I would say funding is probably the resource we're all sort of looking for. Thank you for asking that question. If anyone has any questions about the Jewish Relief Agency or the services we're providing to the 3,500 seniors that we work so hard to support in our community, feel free to reach out to me after today's presentation. Thank you.
Great, thank you so much, Jodi. And as I mentioned, we will have everyone's contact information available on a slide, and we can also put it in the follow-up email that everyone will get who attended this. I would like to now turn the screen over to Portia so that she can share some of what her organization is experiencing in Delaware County specifically. Thanks, Portia.
Thank you, Sara. We are the Multicultural Community Family Services, a community-based grassroots immigrant-led organization serving all who enters through our door or access us for services, but with a target population of working with immigrants. And for this program, in reference to seniors, our immigrant seniors, and then with specific focus on African and Caribbean immigrant seniors. The mission of the Multicultural Community Family Services is to empower individuals, children, youth, and families to gain a greater capacity to succeed in their environment. And in our work with seniors, it is what we attempt to do. The countries represented are India, China, Costa Rica, Liberia, Sierra Leone, Vietnam, Haiti. This work spans at least 4 continents. And we are very honored to be doing it because of the need that exists in our community. In Delaware County, a lot of what I'm sharing today is coming is based on Delaware County. We know that Delaware County is a county of about 565,000 residents, out of which 10.1% of those residents are foreign born. And we do know that within Upper Darby, representing the largest of the foreign born residents, about 20% within Delaware County. And we know of that number, about 13.7% reside or live in poverty. Although we serve all of Delaware County, the primary focus of our work is within Eastern Delaware County, and many of the residents that we serve are residents of Upper Darby. So the chart just shows what the population is with the 5 boroughs predominantly populated by immigrants, particularly African and Caribbean immigrants. And we see the seniors over 65, Delaware County overall is 16.4, Upper Darby 11.5, and of those counties or boroughs, Upper Darby again representing the largest of all of them. I want to talk about our response to our food distribution of our work with seniors, and just I call it the genesis or a timeline going back to 2010 when Multicultural became a licensed non-medical home care agency known as Attentive Home Care. Between around 2012, it really was a wake-up call for us within the African immigrant community when a Liberian senior, a resident of Upper Darby, died by suicide. And it was then we realized that as a community, African community, as an organization, Multicultural Community Family Services, we needed to do more given the circumstances surrounding the death of this senior. And so in 2012. In 2015, it took some time to get us there, but we launched the Elders Circle, which is a program that targets African and Caribbean seniors specifically. And the focus of that program is to bring our seniors together, many of whom came to this country to help raise their grandkids, and all the grandkids had now grown up and moved on to college. Some gotten married, no longer at home, and the majority of these seniors found themselves home alone, depressed, needing companionship. And the Elder Circle was created to do that. And from the Elder Circle program, which brings our seniors in up to COVID twice a week, Mondays, on Tuesdays and Wednesdays from 9 to 5. It provided socialization, companionship, and emotional support through that program. And as we provided that program, our seniors identified the need for access to food. Many were on SNAP. There were others or supplemental benefits formerly known as food stamps. Others were not. Many were not receiving any kind of assistance from the government or from Social Security because there were some who were not citizens of the United States and therefore could not get the kinds of support that others would have received. And so access to food became a real problem. And as they began to talk about it, it initiated for us a call to Philabundance and a request for the support for the CSFP boxes and not CSSP. And so that continued our work and took us into 2007. After many conversations, right around the time Vickie, I believe, started, we were very pleased on April the 7th to have received our first 35 boxes of food for our seniors. It was a great day. And you fast forward to 2020, pre-COVID, before the onset, we went from 35 boxes to about 75 boxes and service seniors, predominantly within Delaware County and parts of Southwest Philadelphia. By April of 2019, through this great partnership with Philabundance and Vickie, I just want to give a shout out to you. Philabundance delivered a large 2-day refrigerator to MCFS, which of course naturally led to our capacity, increasing our capacity to not just receive the CSFP boxes, but now also fresh produce that has become a monthly delivery in addition to the boxes. Pre-COVID, as I said, we're working with delivering about 70 boxes, doing fairly well. We serve about 300 seniors, but not all of them were receiving boxes up to COVID. And then came COVID. We thought we were growing and doing very well. And COVID came with the suitcases and, ready to take lodging into our homes. And we began to see some significant changes with the senior population we were serving. So pre-COVID, we were around 70 seniors who are delivering predominantly boxes through Philabundance. And in April, during COVID this year, we, in Delaware County alone, were serving 60 seniors, and in Philadelphia, 26 for a total of 86. So we saw an uptick in our numbers, and we were able to not serve just Philabundance boxes, but through partnership with foundations and other funders, we're able to get some additional funds to enable us to serve more. So you see in May, we go from 86 total in April to 127 in May, 159 in June, 175 in July, a little dip of 149 in August, and the numbers for September is not yet available, but certainly we saw an uptake, almost doubling our numbers from March through August. What have been some of our observations as a result of COVID? I'd like to say through this, the work that we've done since COVID, our observation is we've seen the nakedness of poverty. It laid bare, we truly saw the emperor with no clothes on. We saw an uptick in poverty, an uptick in increase for need, and we saw the need not just for food, and I'm so glad that Jodi mentioned that, but also for essential items. Items such as toothpaste and bath soap and toilet paper and paper towel, Listerine, which is a common request that has come to us. We also saw that, realized perhaps more than ever before how important a cell phone is to a senior. It really became a lifeline when they were home alone, isolated, and needed to connect with the outside world. For many of the seniors that we work with, a cell phone was such a need, and for some, they could not afford to pay for their cell phone, and Multicultural was able to support them to do that. We also saw the onset or reemergence of trauma. Many of the immigrants that we work with from Africa in particular are victims of war. They experience trauma unlike no other in its most horrendous form. And with the onset of COVID, we were discovering through feedback from seniors the experience of anxiety, of fear, of maybe something really, really bad is going to happen again. And that led to Multicultural creating a weekly virtual support line for our seniors, where they meet every Tuesdays and Wednesdays from 12 to about 1 o'clock to talk about their concerns and to provide emotional support to them. We also saw the need more than ever to really begin to look at food through a cultural lens. Food during COVID, it became more than just meeting the physical. It became spiritual, it became emotional, it became cultural, and it became social. And one of the things that we did as a result of COVID, and as these needs became available, as our awareness increased, was begin to go to the families of the seniors that we serve and to community organizations that we were starting to build better, stronger relationships with, to identify foods that were important to them, comfort foods in their community. What did they eat? And we were able to have many communities specifically identify the types of food that they found meaning in. And through funding from sources within Delaware County and also outside of Philadelphia, we're able to incorporate some of those foods in our delivery to seniors. Like Jodi and I think being Philabundance, we too were going door to door delivering foods because seniors could not come outside. And so for the Liberian community, we were delivering fufu. The Indian community were delivering wheat flour so they could make the pita bread, or injera flour for the Ethiopian community, or for the Spanish community, mesaka. And the Indian, again, pinto beans and papa rice and lentil beans and plantains. And those were so well received because they could identify with those foods, and it took them closer to home. We also saw, as part of doing this work during COVID, there's just the intersectionality between food security and trauma and culture and ethnicity and access to resources, all of them coming together, and I would say in so many ways violently impacting seniors, and the need for our response as provider agencies, recognizing those things and being more culturally responsive. Next slide, should be another one. Okay. How did our efforts change during COVID? For us, more than ever, it said to us that we needed to strengthen our internal capacity even more. We needed to build better collaborative partnerships. We needed to work with more grassroots organizations, and which led to the forming of the Delaware County Immigrant Coalition in April of 2020, comprising of more than 12 immigrant-led organizations serving seniors in Delaware County. There is an anecdote. I do not think we have time to read it, but just thank you notes from some of our seniors, Mr. George from Delaware County, and of course, Mr. Edward Tilley, just saying thank you for the foods and the supports that have been provided to them during COVID, and helping to meet their needs. Thank you.
Thank you so much, Portia. That was a great presentation, and we will also, we've recorded this so we can share it and people can read those notes themselves as well. So thank you, everybody. Now we actually have some time for some questions and answers. So if people would like to write them in the chat box, we are happy to ask our panelists to respond to those. I would like to pose a question to the panel about how Philabundance works with each of your agencies. I think, Portia, you touched on this a bit. How has the partnership been most effective to you?
If for Multicultural, the partnership it has been most effective in that it has allowed a very strong communication between Multicultural and Philabundance in the persons of Vickie. And I cannot tell you how many times I have seen email between our food distribution coordinator, Beatrice Ma, who is not here, and Vickie about many things. There's just constant communication. And what it says to me is that Philabundance is available. They have a listening ear. They want to increase capacity. They want to ensure that their partners succeed, and they are willing to help once those resources or needs are identified. And I pointed one out, such as a refrigerator or freezer. Once those needs are identified, I see some very strong efforts that are made on by Philabundance to ensure that those needs can be met. And that does not happen often. And so we're very, we're really privileged to have that line of communication and to have that kind of support.
Thank you, Portia. Amy or Jodi, do you want to add anything to Portia's comments?
Yeah, I just want to echo your sentiment. I truly appreciate our partnership with Philabundance. We receive food from them for our seniors and for our JRA boxes. Our clients are also, the number of clients we're serving has also just skyrocketed through the pandemic. We used to average 24 new families a month. And we've added almost 500 new clients since March. So we've really seen a very large growth. And we've been able to talk to our partners at Philabundance about our growth and our interest in putting more food in our box than what we typically did. Our boxes weighed between 12 and 13 pounds before. And so we're just cramming as much as possible in there. And so we've worked with Philabundance to talk about being able to bring in more food. And then we've also been able to collaborate with them when it comes to finding partners for the USDA Farmers to Families program. I was able to call on your staff and ask them for some support with making sure we knew who the distributor, a good distributor would be and how that would work. We ended up working with Common Market, and it was somewhat because of the staff at Philabundance who helped make that connection. So we truly appreciate the support and the work that we've been able to do together.
Thank you. Amy?
Yeah, I'll add that for PCA, the biggest partnership and area that has been, and it touches on what Vickie talked about the CSFP boxes, is really meeting our senior centers where they were at and ensuring that the distribution can still happen even if it wasn't in the same way that we were used to or the seniors were used to. So having that flexibility to work with our senior centers and their communities to ensure that those boxes of food still got to them in the ways that worked for them, but may be a little bit of a flex model compared to what we're used to. So it was really helpful that those communication channels stayed open and everyone was open to changing the model.
Great, thank you. And one of the viewers has asked, what do you anticipate being the greatest challenge in providing meals to seniors in the coming months? Who would like to take a crack at that? It's a good question.
I can. Funding. The greatest challenge is funding, and I know Jodi
Okay,
talked a little
that
bit.
is the second call. Funding. As the Chief Development Officer, I just have to say I didn't say that. This is coming from the heart of these people here. Jodi or Amy, would you like to add anything?
I would also say supplies. So we were able to order all of our seniors, actually all of our clients. We ordered face masks, like hospital face masks for them, and we put them in our boxes. We put 2 in every month for like 4 months. So for us, we were really thinking about what is the health and safety of the individuals we're serving, and I wanted to provide hand sanitizer. I couldn't get it. It was crazy, just like how the food chain was broken and getting the food we needed in April was really challenging, and Philabundance was great working with us, and getting hand sanitizer was very challenging. So we ended up ordering from a swag company, how you can get your name and with your logo on some hand sanitizer. We did that. And so it was funny. Our clients actually, we heard, thank you so much. I can't believe you sent us branded hand sanitizer. Well, we sent branded hand sanitizer because we couldn't find it anywhere. So it still took, several extra weeks. I think it took 6 extra weeks for it to come to us, to get to us. But, we really wanted to put hand sanitizer in every box. And in our Holocaust survivor supplemental bags, we wanted to put hand sanitizer in there as well. So we worked really hard to be able to do that. So I think providing, also the comfort food that some of our clients are also used to in their own, in the countries they're coming from. We serve a large immigrant population, just like some of the other speakers. And we also wanted to pay attention to providing some of that comfort food. So we did pay attention to that. I think that that's really important to take into consideration, people's cultures and where they're coming from. And especially in a time of crisis, what food they would like to eat during a pandemic, and it might not be the same as what I have in my kitchen, and I should be able to try to source that the best I can. So we're really trying to do that, just like Portia is trying to do that.
Thanks, Amy. Vickie or Amy, do you want to add anything?
I would say the challenge that we're facing at PCA in the coming months and kind of looking forward is our congregate meal program. These seniors are active and are used to coming into the senior center for socialization, seeing their friends, and doing activities, and really keeping everybody engaged and building connection in a way that is virtual, because we want to keep everybody safe, but also recognizing that, like, what can we do safely, and also providing meals in a safe way. Everyone's itching to be with people, and it's really hard balance to continue to provide meals in a safe way and provide that engagement, provide that socialization in a world where we're still learning so much, and we're trying to keep everybody safe between our staff members, volunteers, and the seniors themselves and the community, and just the challenges of, you know, getting everybody the grab and go meals and ensuring that people can pick them up. People through the winter can come, maybe they're in walking distance, is that it's still possible in the winter. Things change throughout the seasons about that type of kind of environmental situation, kind of like in the summer, we were dealing with the heat, and senior centers would previously be cooling sites and they weren't available this year. So, you know, it is a challenge that we foresee coming about that. Those active seniors who are used to being very active in the community, getting that itch again to come out and wanting to support them and finding ways that is unique to their situation.
Thank you very much. I think we're going to hand it over to Loree Jones for some closing remarks now. And we're also going to give you the information we've been promising. There it is. And why don't we leave that up here if people need it while Loree closes off our session for us. Thank you.
Thank you so much, Sara. Thank you everybody for participating. Thank you especially to Portia, Jodi, and Amy for the informative presentation today, but also for the work that you do and the heart that you bring to the work. It is so clear that you have the information and data, but you also care about the people in the communities that you're serving, and just so fortunate to have, we call people like you helper heroes, folks that are like on the front lines and really championing and providing services, particularly at this moment in time. So thank you so much to each of you and to your organizations for your work and partnership. Thank you also to the incredible people I get to lead, including Vickie and the great work that they do. Definitely what came through in the conversation was, you know, really the way that we try at Philabundance to support everybody in the community to ensure that we're getting and meeting this increased need, particularly and providing older folks in our region with access to the food they need and the other services they need, and the care and the heart, and trying to address the trauma that people are experiencing, trying to address this issue of isolation and loneliness, which we know leads to worse, tougher outcomes. And you guys are really doing that in a holistic way. So grateful that Vickie and the other folks at Philabundance are able to support you in that. I also want to say a special thank you to the folks that are listening and tuning in. I know we have several board members who really guide us in this work. So thank you so much for being here today. I want to highlight something that Vickie mentioned. She kind of mentioned it in passing. We're really, as all of us are addressing, responding to COVID and responding to these new challenges, and it really has laid bare some ways the systems weren't working so well before. And so we realized that we need to, even post-COVID, if we ever get to that point, we need to continue to provide people and services in the way that makes most sense to them. And so if that means to continue some of the distribution to seniors, we need to do that. And so Vickie mentioned that we're doing that. I know we are partnering with organizations that are on this call, as well as with the City of Philadelphia, to develop a plan to do that on an ongoing basis, and do that and still understand, as each of you mentioned, that we also need to think about ways of making sure there's still that human interaction and connection. But we are committed to doing that. And we'll be having this pilot program that Vickie referenced that I'm particularly proud of. The team here at Philabundance knows a couple weeks into my tenure here, I had the chance to volunteer with one of our agencies, Kitchen of Love, and go and spend a Saturday delivering foods, delivering these boxes that you all showed pictures of and talked about today. And as I was carrying them, I realized this is really heavy. And I thought about my 76-year-old mother who was at home, who doesn't like to carry the packages that she gets from the grocery store, and she makes them light enough for her to carry, right? And so the reality is we need to think differently about how we're providing services to people. So glad that you all are doing that, and we at Philabundance get to do that as well. I'm also glad that you talked about the various ways that people could help. We definitely need volunteers, and surprised Sara didn't say it. What is it, Sara, that we need? We need friends, food and funds, and not necessarily in that order, but definitely for the folks that are already supporting us on this call, if you can reach out to folks that you know, clearly these agencies could use that additional support in terms of friends, food, and fun, and we invite you to continue to support these efforts. To give you a sense of what that means for us, at Philabundance, our fiscal year started about a week ago. We run on an September fiscal year, and in responding to COVID and looking at this increased need, our board, we made a commitment that we're going to spend nearly 10 times as much on food this year. So in the last year, we'd have a budget of about $1.5 million that we're going to spend on distributing food, and we supplement that with donated food. You all know about the food supply. You know that donated food numbers are going down, but we're looking at spending $10 million this year on food to be able to support the agencies that you see here, but also just to ensure that more people in our 9-county region are getting access to the fresh, healthy food that they need, particularly during this difficult time. And so we thank you for everything you've done already to support this work, and definitely our partners and our funders, and invite you to continue to partner with us as we continue this work going forward. Thank you so much for investing in us, your time, your resources. Thank you so much for taking the time to learn more about this work as we're learning about it and developing, we look forward to the next opportunity we have to meet with you and partner with you. So thank you all so much. Be safe and stay encouraged.
Thank you.
Thank you.
Pleasure.
Thank you.
Loree.